Thank you. I'd kiss you, but I'd mess up one of our microphones. Hi. Nice to see you all on a Saturday afternoon. I think this is probably the most comfortable place on the planet right now in terms of temperature. I want to thank you all for coming. Couple things. First, it's tough to follow Sherry, so I'm neither as good as she, nor am I as articulate as I appeared on the video. I think that took about 47 takes, so I don't remember. But I do disagree with Sherry. Sherry says, you know, what do you say when someone asks you how you are and you say, well, I'm busy? I never say this. Try this at home. You try this at home too. When someone asks you how you are, you say, I'm spectacular. I guarantee you, it makes you feel better, it makes them feel better, it will stop them in their tracks, and it makes you a better day. So how are you? Spectacular, great. Thank you. I'm spectacular too. So, this is Englewood Hospital. Back when Sherry joined. And, I'm sorry? I'm the one with the white hair, that's correct. But you don't know about Sherry is she used to be a blonde. There was, this is before my time, and I can brag about this because I was not a part of this. Back about 25 or so years ago, the leadership of the witness community was looking for partners in healthcare. And they went to a number of the hospitals in the region, in the Northeast, and they went to the leadership of each hospital and said, you know, we are people for whom blood is not an option. We would like to partner with you in our care, and you know, can we work together? Is there something that we can do in order to make sure that our community can be cared for? And of course, the answer at virtually every hospital was yes, of course. Of course we are going to care for you. Of course we're happy to work with you. And of course, we're not going to give you blood unless you need it. And to the credit of the leadership at Englewood Hospital and Dr. Shander, whom you saw on the video, the chief of surgery, my predecessor, Herb Dardick, and the team, and Sherry really made this happen. The answer was a little bit different. The answer was, of course we'll work with you, of course we respect your wishes, and of course we will care for you and be partners with you. But, in order to do this, let's study this. Let's make sure that we're doing the right thing all the time while we still are able to respect your wishes and care for patients, not only witnesses, but any patient who has made the decision that blood is not an option. And that was about 25 years ago. So, in the interim, a few changes have been made. Always a great medical staff, always a great nursing staff. What happened along the same time at Englewood Hospital is the board of trustees and the hospital leadership said, you know, our focus is on quality. And at the same time that the bloodless program was getting off the ground, there was a focus on quality throughout everything we did at Englewood Hospital. And again, before my time, so I can continue to brag about it. And here are just some of the awards that we've won. In fact, I wish I had the picture, but we actually, whoa, that's loud. So we said, you know what, that wasn't a good enough hospital to care for our patients with the quality. So one summer day, we did a little bit of a Tinker Toy project that led to really what the campus looks like now, and where we care for every patient the same way, respecting their wishes in a, as Warren, our CEO, said, a humanistic environment, which we are very, very proud of. It was a good day. So when you come up to Englewood Hospital and you drive in, from the minute you drive up and see our modern facilities, to the minute you walk in the door in our lobby and are met with an incredibly bright, well-trained, beautiful, friendly team of people, and our medical and nursing team, most of whom are here in this photograph. We have built over the last several years now, and I'm proud of this because I was a big part of this, the facility to match the award-winning care that we give. So from our new units on the floor, this is actually, you wouldn't believe this, but this is a delivery room where all the monitors and everything are hidden. Modern new ORs that opened even a few weeks ago. We opened brand new state-of-the-art operating rooms where surgeons have the most advanced equipment, and we have the most advanced surgeons. In this picture alone, by the way, there's Mount Sinai, National Institutes of Health, and NYU, all in one picture in terms of who the physicians are that are providing the care to our community. We went out and got the best doctors and brought them in throughout all of this care. And for those patients who need advanced cancer care, this is actually, we're the only ones in the region with this machine, which is called a Varian TrueBeam machine. And if you look at it, it's actually very cool. You look up in the, up in the sky there. You feel like you're lying there out in the open. We really did everything with the patient's feelings in mind. We actually got feng shui experts in there to make sure it was all nice and well done. You don't realize when you're lying on that table that you're actually lying under 5 feet of concrete. Really everything was pulled together to make it beautiful. And when you leave the hospital and the team waves goodbye, you know that you're still in an environment where people care, and particularly now with the program with the Institute of Blood Management and Bloodless and Medicine and Surgery. It is a mouthful. Just going to call it Bob for short. You know that you're really getting incredible care. So we now at Englewood care for about 1 million people a year. We touch 1 million lives a year. We provide $38 million a year in free care and charity care for those patients who can't pay. We see about 50,000 patients a year in our emergency department, which is only a few years old, and again, a beautiful, humane facility like the rest of what we built. We do about 57,000 mammograms. And we care for about 1,000 people a month for whom blood is not an option. And as Sherry pointed out, as some of the people on the screen pointed out, and as Doctors Fiorillo, Kapoor, and Griffiths will tell you about their specific expertise, we have these world experts in caring for patients for whom blood is not an option. And it's not just about the witness community. It's really about everything we do for all patients now. And really, we have you to thank for that because of your partnership with us over the past 25 years. So, tell you a little bit about my story. I was at Mount Sinai. I usually don't say it aloud. I don't like to badmouth other institutions. I love it. I trained there. I lived there for 25 years. It's in the packet, though, so you know where I came from. And I got busted by somebody earlier who knew me from Sinai. But wonderful place. Love it. It was great. And I actually lived in the community of Englewood Hospital, which, by the way, does have excellent food. Thank you. Mom, thanks. I drove past Englewood Hospital every day, and I heard the radio commercials about bloodless medicine and surgery, and I really thought it was a radio commercial. Move forward now. I live in the community. I raised my children there, and I had the opportunity to come and practice at Englewood as the new chief of surgery. And one of the first people I met actually was Sherry, who they came to my little office before I even had anything in it and sat down and didn't say, this is what you're going to do, this is what it's about. She taught me. And we sat down and we discussed what's been going on, what the radio commercial was about. And really, she began to teach me, as she has continued to do 5 years later, about how to care for patients without even thinking about using blood. And I've totally transformed the way that I practice, to the extent that, in this picture, I'm with our CEO, Warren Geller, as we're building our new operating rooms. This is probably, now a few years old, this picture, and with also the head of facilities. And I said to them, well, this would be a really good place because we need a lot of space for the blood refrigerators. And they laughed, and they said, we don't give blood here. So back to the award-winning care. So really what happened now, I was in practice for over 20 years at Mount Sinai, where I care for, and sometimes I've been fortunate enough to give talks like the other doctors are about their own specialties. I care mostly for patients whom bleeding is a major issue, Crohn's disease and ulcerative colitis, as well as colorectal cancer. And almost every one of my patients is anemic when I meet them. And we looked back, and over the course of 20 years at Mount Sinai, about 25% of my patients, of my own patients, received blood transfusions during part of their care, 25%. And we thought that was pretty good. I've been at Englewood now almost 5 years. I've operated on a few hundred people with Crohn's, colitis, and colorectal cancer. And I'm proud to say, I'm going to say probably about 25 patients were in the bloodless program for whom blood is not an option. So not a big number of those patients, but I'm very proud to tell this room that in that 5 years, in those hundreds of patients, I have given a grand total of 1 unit of blood to 1 patient. And I'm really upset about that 1 unit of blood. And without giving myself a kind of hara, which is Yiddish for jinx, the outcomes, the complications, the outcomes of my patients, the complications have never been fewer, and the outcomes have never been better. And there is nothing different about what I've done other than to have been taught by our team and working with this interdisciplinary team of physicians, nurses, and the bloodless program to learn how to better care for all of my surgical patients. So we are, in all aspects, the patient always comes first. Patient safety always comes first, but it's always in an atmosphere of respect, care, and we treasure our relationship with the community, both the witness community and for all of those patients for whom blood is not an option. And I want to thank you all for taking a Saturday to learn a little bit about our program. We are very, very proud. The latest award that we achieved, we are one of only 2% of hospitals in the country to have received now for the 4th consecutive time a magnet designation, which means that our nursing staff is among the best in the country, and we treasure our nursing staff, and they are really a part of what makes this happen, and we celebrate that all the time. So, welcome again to the new Englewood Hospital, where really our outcomes have been made possible by our partnership with this community. Thank you again for your time and attention. I'm afraid I'm not going to be able to stay for the question and answer period, but I know that Sherry and the team will be more than happy to pass along any questions you have for me. So my apologies. Thank you again, and I look forward to a great program.